whatever it is. But we're talking the teeth largely. Dr. Samuel Atinka is a dentist and works at the Dell Dental and Implant Clinic, Accra. We're talking largely about common dental conditions and how you can prevent them. What are some of the common... Oh, very well. Thank you very much for your time. I wanted us to jump straight into it. How are you, though?
I'm good.
You are good.
Yeah.
Tell us about the teeth and how you think people have taken care of it. Because, I mean, it's one of the things I really do not check. Should it be something I should be checking all the time?
Yes. So, Ghanaians, it looks like that's our culture. We don't really take good care of our teeth, okay? And, well, so oral health is not just about the teeth.
Okay.
So it deals with the teeth, the gum, yes, and then there's soft tissues in the mouth,
so,
the bone as well. So we recommend that every 6 months.
Every 6 months?
Yes, every 6 months. You come see a dentist. He would do a checkup. He or she will do a checkup, possibly do some cleaning for you.
Okay.
Yes. So that goes a long way into preventing the case from worsening.
Okay.
Yes.
All right. So there must be checks, just like you do general checkup. There must be the check on the teeth and all the other issues around it.
Yes.
That's what you're saying. Let's
Yes.
now talk about some dental conditions that probably we do not know about, and I would always gloss that there because, hey, Charlie, the teeth is fine. It's chewing bones, it's eating gobe and things and things. But tell me some of the conditions.
Okay, so the common ones that we have is cavities, so dental caries. We have
cavities means holes.
Yes, holes in the teeth, yes. We have gum disease. So gum disease has two entities. There's a milder form and then there's a more severe form.
Okay.
The milder form is gingivitis, and then the more severe form is periodontitis.
Okay.
So, and I'm sure you know what the gum is. The gum is the flesh around the teeth, yes. So when you have an infection of that, that's when it's called gingivitis, yes.
Okay.
But it's not just the gum. The tooth has some supporting structures outside the gum. That's the bone, and then a periodontal ligament. So when those ones do get affected, then the case is getting worse.
Okay.
Yes, so that's when it goes to
I see.
periodontitis, yes. We also have halitosis. I'm sure you are aware.
But it's not about me, so explain to our
not you. I mean,
don't take it out.
dental.
No, yeah, so go ahead, break it down so that for the benefit of our viewers largely.
All right, so there is also halitosis. Halitosis is bad breath. Yes. We also have oral cancers.
Okay.
Yes. There are some people who have missing teeth and all that.
Okay.
Yes. I think as time goes on, I'll break down.
All right, so because we do not have time, we'll put all of them together. So what causes the cavities?
So, yes, so the cavities are usually, they are caused by sugar, the breakdown of sugar.
Sugar?
Yes.
Oh,
so, yes, so there's bacteria in our mouths, okay? So the bacteria, they feed on sugar, right? So usually when you eat and then you don't brush very well, you don't rinse, and then there's sugar, hidden somewhere. Yes, you have these bacteria that go and act on it. So they break the sugar down and then produce acids.
Okay.
So once the acid is produced, so the acid is what will start to dissolve the tooth and then create the cavity. Yes.
Is that why children who eat a lot of toffee have they say they have holes in them and all that? Oh,
yes, yes. And another thing too about toffees is that, yes, so it has sugar, right? But it tends to stick to the tooth. So when you don't rinse or when you don't brush very well, so then it tends to stick there, causing the cavities.
I see. All right, so that's for cavities. So what it means is that immediately you eat before you sleep or wherever you are going, just rinse.
Yes, so you wake up in the morning, you brush your teeth, okay, and then you also floss. Okay, so floss is like a thread that you pass between your teeth.
Okay.
Yes.
All the time?
Yes.
Oh, okay.
When you are brushing.
Okay.
Yes. So what that does is the brush, I mean, yes, we say you have to brush, but the brush is not able to get to all the surfaces of the teeth. You see, there's a part where the two teeth meet, the ones that sit side by side. Yes. There's a part where they meet. So the brush is not able to go between there. So once you use the floss, the floss goes through those spaces and removes the food debris from there. Yes, so that's also an important thing to do when brushing. Yes,
I see. Okay, so that's first of all. So that's in the morning, for instance. You get up, brush, ensure that what. So whatever. What about if you finish eating?
yes. So when you finish eating, naturally the saliva is supposed to, clean the surfaces, but you can also rinse your mouth.
Just rinsing.
Yes,
rinsing is fine.
Just a normal rinse.
Is it after every eating you can choose to rinse it?
Yes.
Yeah, after every eating.
Yes.
How about in the evening?
So in the evening you brush your teeth.
You have to brush your teeth.
Yes.
So it's twice a day.
Twice a day.
Okay.
So
compulsory.
Compulsory.
Charlie, right now the toothpaste is expensive. You still would. Charlie, bro.
Okay. So
yeah. Are there other alternatives?
You have to brush your teeth.
Okay, seniors, you have to brush your teeth. I was advocating so that the dentist could show us. But how about using chewing stick?
Yes, so you can also use it, but you always have to add the brush to it. So you use the chewing stick to, go around it.
Okay.
But it is better if you use the brush or if you add the brush to it. And then you floss as well.
I see.
Yes.
I see. Okay, so that's for cavities and how you can prevent it, the holes and all that. Let's now talk about gingivitis. Is that it?
The gum disease.
The gum disease.
Yes.
How does it come about? What can we do to prevent it?
Okay, so when we're talking about gum disease, so there's something called plaque. So plaque is like a film, right? So it has saliva, it has bacteria, possibly some food debris. So when we say you should brush twice a day, when you are brushing, because it's a film, the brush is supposed to remove the plaque, okay? So when you don't brush regularly or you don't brush well, some of the plaque still stays on the tooth. When it stays on the tooth, it becomes hard. When it becomes hard, then it forms a calculus. So that calculus that's formed, your brush is not going to be able to remove it. So this forms a surface for bacteria to also form on it. So when this plaque forms, and then usually forms between where the gum and then the tooth meet, okay? So the plaque would irritate the gum. So with the irritation, that's when you have gingivitis. So it causes the gum to be inflamed.
Okay.
So with inflammation comes reddening, swelling, and then some pain. Yes. So when that is not addressed and it continues, once there is chronic inflammation, that leads to periodontitis. So then you have the periodontal ligament, the bone starts, reducing. And then what you see is when that starts happening, your tooth will start to become a little loose. So it starts to shake. Yes.
So that could lead to further loss of teeth.
Yes. So that actually leads to further loss of teeth.
I see.
And the way to go about it. So when we advise that you come every 6 months to do the cleaning, well, so once you have the calculus on it, the only way that it will go is for us to use the scaler tip, right? So like a machine to remove all the calculus from there. Yes. But if you don't come and it is there, it is only going to worsen. Yes.
So what it means is that, Charlie, is it too expensive to do the cleaning that you talk about?
Well, it's not very expensive when you look at the advantages, right? Supposing I don't go and clean my teeth and I have maybe a cavity or I have gum disease, okay? In the long run, when you are trying to address that situation, it's going to be more expensive than if you are just come for the normal routine cleaning. Yes, so sometimes it sounds like it's a bit expensive, but I mean,
but
for
if
the
you look
long
at
run,
what it brings to you, the benefit it brings to you, and all that, I think so. That's for the three we talked about: the cavity, the gingivitis, and the other one.
So halitosis.
Right. Okay. So let's now do halitosis.
Yes. So that's odor. So halitosis, well, bad breath. There are several causes. Okay. These things that I've mentioned, the cavities and then the gum disease, they also cause halitosis. Okay. We also have people who have prosthesis, right? So dentures, bridges, and all those things. When you don't clean them well, you have food debris, bacteria, and all those things on it. That also causes halitosis. When you brush and you don't brush your tongue very well, yes, you see the nature of the tongue, their surface is irregular, right? So it is very common for bacteria, food debris to get stuck between that. So if you don't brush your tongue very well, you'll find out that those bacteria will be feeding on the foods which are there. Then they will create the bad breath.
Okay.
Yes. So, that is one major side. Yes.
Right. The others, I mean, a lot of people also say that sometimes even if you starve, the stench will come from your tummy rather, not the mouth.
Okay. Yes. So those are extraoral causes of halitosis.
Okay.
Yes. So you have systemic diseases. You have gastric reflux. There's also like that.
I see. That could cause
halitosis. Yes.
I see.